Good afternoon. I'm Tom Stolz, the county manager, and we are here to talk about COVID-19 update numbers for August 19th. We'll do like we usually do. We'll go through the national numbers and work our way down to the local numbers. In the United States, our percentage of positive cases went up 1.68%. So we stand at a little over 5.5 million cases today in the country that have been validated. In the state of Kansas, we went up 2.06%. That puts us at 35,890 cases for the year. And the Kansas death total is sets at 411. In Sedgwick County, between Monday and today, we went up 1.55%. That is 5,405 cases we stood at on Monday to 5,489 cases today. Our Sedgwick County deaths are at 47. For the week, since the last time I talked with you, last week the county stood at 5,068 cases, and today we're at 5,489. That's 8.31% increase. Our deaths went up 1. All of these numbers are better than they were the last probably 3 or 4 weeks. We had in 2 days we had a 1.55% increase. We've had many days where we had 100 extra cases a day. So these numbers are trending the right direction. We've mentioned that many times before, and it's there's some reasons for that. Mostly these guys seem to be working. We're doing a better job of distancing, and our numbers are beginning to trend downward, which we want to continue that. From a health department update perspective, more than 67,000 residents have been tested for COVID-19 in Sedgwick County. We have 126 residents scheduled today through the drive-through site. The health director reported this morning that we are caught up, so if you need an appointment, go through 211, and if you call before 4 o'clock today, you will be scheduled tomorrow. Still the same protocol, still testing symptomatic people or asymptomatic people who are working in certain high priority professions who deal with those most at risk. And again, call 211 United Way the Plains to access the process. This week from 8:30 a.m. to 11:30 a.m., the mobile outreach team will provide COVID-19 testing for symptomatic residents or contacts of COVID-19 positive people Thursday at Hayesville. That's August 20th, Thursday, Hayesville Community Center, 130 East 2nd in Hayesville, 8:30 to 11:30. Monday, August 24th at the Clearwater Community Center, 921 East Janet, Clearwater, Kansas, 8:30 to 11:30. And on Wednesday, the van will be at Tabernacle Bible Church, 1817 North Volusia in Wichita. Again, 8:30 a.m. to 11:30 a.m. We had put out some information earlier this week about taking away recovery data. There was 3 reasons we did that. First of all, the staff was becoming inundated with the number of positive tests and all that goes into managing that. So we were focusing on calling people back who had positive or negative tests because that is very important that we get a hold of those people quickly, so we focused our efforts on that. To get recovery numbers, we have to call people at home repetitively to determine if they are feeling better and if they feel like they are recovered. It takes a human-to-human contact, and that is very time-intensive. And quite honestly, our staff just ran out of time with the nature of the infection and how many cases we were realizing. So based on that, and we had talked about this for a number of weeks in commission staff meetings, that number just did not seem to be as accurate as it should be, and we were trying on our dashboard very vigilantly to stay accurate with data that is good. Additionally, we have found out through medical providers and our communications with doctors, not only Dr. Menz, but doctors around the county, including at both hospitals, that they're seeing a number of patients who are coming back in with sicknesses or problems when they have already recovered from COVID. So these, if you're reading the internet at all or following this, the medical community has termed them long haulers. And those are people who have gotten COVID, gotten over COVID, and now have some type of ancillary problem, kidney, clotting, cardiac kind of issue that now is driving them back into the hospital system again. Or we have a number of people who have COVID symptoms and they just can't seem to shake them. Just because an average is out there of 10 or 15, 20 days of recovery, people are different, and some people just are struggling with this for weeks. And now that the virus has been here for 6 months, we have seen patients that have had months of symptoms. So it didn't seem very genuine to say that we were getting recoveries when we knew we had this third category of people coming in. We tried to keep track of active cases in the community. Two issues with that. Number one, it's based on recoveries because we got active cases from the number of positive cases minus the deaths minus the recoveries. And since the recovery data was just not keeping up, we had to stop active case counts. And everyone we've talked in the medical field and the national CDC says there's more active cases in the community than what's being reported to government. So we're in trying to keep our dashboard as pristine as possible with good data that people can rely on. We've modified what we've been putting on. On the testing front, Mr. Kaufman reported this morning to the commissioners that we are caught up now at our drive-through site. So if you need an appointment, if you're feeling symptomatic or you're asymptomatic and you're in the service of those who are high at risk, you can get an appointment next day. We still can't, how fast the lab processes these and gets them back to us is still too long, a number of days. So we ask that people be patient with that. And we have, for those, and I think I mentioned this last week, we have two strategies moving forward to try to improve this. One is to do immediate business with a laboratory in Lenexa who can do saliva-based testing now and have a 24 to 48 hour turnaround. So we are trying to, working on contract with them. And then Wichita State University, we are working with their staff. They have capacity and are building capacity to provide rapid testing, saliva-based testing. And I was talking to a member of their staff yesterday. They think maybe they could be up and running by early October. So good news on that front, that Wichita State is maybe moving a little faster than we'd originally talked about. So both of those things we're working toward. Dr. Mintz put a new order out. We discussed it thoroughly this morning at the commission meeting. And I think his intent of the order is to try to keep the community safe as we're trying to get schools open over the next 2 weeks. Masks are still mandated. He thinks that kids should wear masks. We are going to allow some nightclubs, all nightclubs, to reopen with reduced capacities and hours, hoping we can get them safely back open without altering the course of what we're seeing these numbers do. And he has put capacity on drinking establishment restaurants and limited their hours to 11 p.m. as well. And part of that is so that there's a fair and equitable playing field between the businesses out there. But most importantly, all businesses now are back open in Sedgwick County. The government nor Dr. Mintz has put any regulation stopping any business from being open, and that's a step in the right direction. But we have to keep our numbers down. We are hovering 9 or 10% of infection rate right now, which means that for every 100 tests that we conduct as a community, that 9 or 10 people are showing up positive. Of course, ideally that'd be 0, but in a world of CDC, if we can get that to less than 5, that means your rate of infection is low enough that you can function better as a society. So Dr. Mintz has stressed in his order that we still want to continue to drive that number down, as it has been going down for the last couple weeks. But I think he used a basketball analogy that at halftime, if you're winning, you don't stop. You continue putting pressure on, and that's what he wants to do to the virus through this order. So with that, that's all the information I have for today. We'll be back again next Wednesday to discuss numbers, and everyone have a safe week.